Type 2 diabetes. This chronic, long-term disorder causes the bloodstream to circulate with an excessive amount of sugar. Eventually, cardiovascular, neurological, and immune system issues might result from excessive blood sugar levels. There are basically two interconnected issues at play in type 2 diabetes: the hormone that controls the flow of sugar into your cells. Insulin is not produced by your pancreas in insufficient amounts, which causes your cells to react poorly to insulin and absorb less sugar. Although there is no cure for type 2 diabetes, you can manage the condition by decreasing weight, eating healthy, and exercising. You may also require diabetes drugs if diet and exercise are insufficient to control your blood sugar. Causes. The main causes of type 2 diabetes are two connected issues, and insulin resistance develops in the muscle, fat, and liver cells. These cells don't absorb enough sugar because insulin doesn't interact with them normally. Insufficient insulin is produced by the pancreas to control blood sugar levels. Although the exact cause of this is uncertain, being overweight and being sedentary are major risk factors. Symptoms. Type 2 diabetes symptoms and signs frequently appear gradually. In fact, you may have type 2 diabetes for years without realizing it. Signs and symptoms may include increased thirst, continual urination, increased appetite, inadvertent weight reduction, fatigue, distorted eyesight, sores that heal slowly, continual infections, tingling or numbness in the hands or feet, pigmented skin, typically in the neck and armpits. The part glucose plays. The following are some examples of how glucose is used and regulated. Food and your liver are the two main sources of glucose, and insulin helps glucose enter cells once it is taken into the bloodstream. Glucose is produced and stored by your liver. The liver converts stored glycogen into glucose when your blood sugar levels are low, such as when you haven't eaten in a while, in order to keep them within a normal range. This method is ineffective in type 2 diabetes. Sugar accumulates up in your bloodstream rather than entering your cell. The insulin-producing beta cells in the pancreas produce more insulin when blood sugar levels rise. Weight is one factor that may make you more likely to develop type 2 diabetes. Obesity or being overweight is a major risk. Distribution of fat. A higher risk has indicated if you store fat primarily in your abdomen rather than your hips and thighs. Your risk increases the less active you are. Ancestral history. If your parent or sibling has type 2 diabetes, your risk of developing it also rises. Age. Type 2 diabetes risk rises with age, especially beyond the age of 45. Prediabetes. When your blood sugar level is over normal but not high enough to be diagnosed as diabetes, you have prediabetes. Prediabetes frequently develops into type 2 diabetes if left untreated. Risks connected to pregnancy. If you had gestational diabetes while pregnant or had a baby that weighed more than 9 pounds, your chance of getting type 2 diabetes is higher. Avariant cystic syndrome diabetes is more likely, and those with polycystic ovarian syndrome, a prevalent disorder marked by irregular menstrual cycles, excessive hair growth, and obesity. Skin discoloration, typically in the armpits and neck. Complications of numerous important organs, including your heart, blood, arteries, nerves, eyes, and kidneys, are impacted by type 2 diabetes. Additionally, risk factors for diabetes also increase the chance of other significant chronic diseases. Your risk for these consequences or coexisting illnesses can be reduced by taking care of your diabetes and regulating your blood sugar comorbidities. Diabetes and other common comorbidities could result in the following complications: blood vessels and heart disease. Diabetes is linked to a higher risk of heart disease, stroke, high blood pressure, and blood vessel narrowing, atherosclerosis. Limb nerve injury, neuropathy. Over time, high blood sugar can harm or kill nerves, causing tingling, numbness, burning, pain, or even ultimate loss of feeling. These symptoms typically start at the ends of the toes or fingers and progressively move up the body. Additional nerve injury. Heart rhythm irregularities might be a result of damage to the heart's nerves. Digestive system nerve injury can result in issues with nausea, vomiting, diarrhea, or constipation. In men, erectile dysfunction may result from nerve injury, kidney illness. Dialysis or a kidney transplant may be necessary if diabetes results in chronic renal disease or irreversible end-stage kidney disease. Eye injury. Diabetes may harm the blood vessels in the retina, potentially resulting in blindness, and also raises the risk of significant eye conditions such as cataracts and glaucoma. Skin problems. Diabetes may make you more prone to bacterial and fungal infections among other skin issues. Slow recovery. Cuts and blisters can develop into dangerous infections that may not heal properly if left untreated. Amputations of the toe, foot, or leg may be necessary for severe injuries. Impaired hearing. Diabetes patients are more likely to experience hearing issues. Sleep apnea. People with type 2 diabetes frequently experience obstructive sleep apnea. The primary cause of these illnesses may be obesity. It is unclear if treating sleep apnea leads to better blood sugar regulation. Dementia. The risk of dementia illnesses like Alzheimer's and other types of dementia seems to be higher in those with type 2 diabetes. Memory loss and other cognitive impairments are connected to poorly managed blood sugar levels more quickly. Prevention is better than cure. Even if you have biological relatives who have the disease, adopting a healthy lifestyle can help prevent type 2 diabetes. Changes in your way of life may slow or stop the development of diabetes if you have been diagnosed with prediabetes. Eating healthy foods is one aspect of living a healthy lifestyle. Pick foods with more fiber and fewer calories and fat. Put an emphasis on whole grains, veggies, and fruits. Getting moving. Aim for 150 or more minutes per week of cardiovascular exercise that ranges from moderate to vigorous, such as a brisk walk or a bike ride or run or swimming. Shedding pounds. Your risk of type 2 diabetes may rise if you spend a lot of time sitting still. Every 30 minutes, make an effort to get up and walk around for at least a few minutes. An oral diabetic medicine may be administered for persons with prediabetes to lower their risk of developing type 2 diabetes. High blood sugar levels are a common symptom of type 2 diabetes. Frequent urination, increased thirst, hunger and fatigue, eyesight issues, sluggish wounds healing, and yeast infections are a few early warning signs and symptoms. Few natural ways include 1. Regularly exercise. 2. Control your calorie intake. 3. Consume more fiber. 4. Keep hydrated by drinking water. 5. Select meals that have low glycemic index. 6. Control your level of tension. 7. Get enough good sleep. 8. Consume foods high in magnesium and chromium. 9. Retaining a healthy weight. 10. Consuming wholesome meals.